Still loading in just a little bit. Welcome everyone on this very hot, very sunny Friday afternoon, at least for those of you who are located in Southern California. As people are loading in, I'll just let you know, we are not going to be able to call on people today, so no need to use the hand raise. Best thing for you to do is go ahead and ask a question using the Q&A feature. And if you're on Facebook, sometimes we're good enough to catch that you've asked a question on the Facebook feed, but not always 100%. So apologies if we missed that. But for those of you who are on the Zoom call, do go ahead and use the Q&A feature to ask any questions. And we will get started in just a moment. We're just kind of letting everyone load in here, and then we'll get started. It does look like we're getting a little bit of stability in the participant list. So I'm going to go ahead and get started, recognizing it's a Friday afternoon or possibly Friday night or even early Saturday morning, depending on where you are in the world right now. I'm Jillian Hayes. I'm the Dean of the Grad Division, and today is our second in our new series of monthly town halls, in which we're going to assemble a dream team of people to answer your questions each month, depending on what are sort of the hot topics of the moment. So with school starting up in about 6 weeks and many people venturing back into research labs, moving back into grad housing and so on, we thought for this month's topic, we'd really cover what our sort of return to campus procedures are, what we're doing and watching, how things might change and all the rest. So I'm gonna introduce the rest of our panelists here in a moment. They will give you some background info quickly. Thank you to those of you who sent questions ahead of time. We'll try to address those in this period. And then we'll start an open Q&A section. So a couple of things that I just want to address centrally from Grad Division. We get a lot of questions this time of year always, and as you might imagine, it's more so in the COVID world, from incoming students asking for details about their academic programs, asking what rotations might look like, asking about things like leaves of absence and other kinds of sort of academic related issues. Our first stop is always going to be to refer you to your program. Individual programs at the graduate level often have different policies and procedures around these. So just know that, and your individual program is the best to talk to you about individual coursework and so on. And then if you're not able to find those people, certainly do, of course, come to us, but mostly we're going to push you back to them. The other big question I'm getting right now is what's happening in winter. We are not going to discuss what's happening in winter today. We're just going to focus on fall. The campus hasn't decided sort of fully what we're going to be doing with winter, and we're quite a ways off. I always try to remind people the time difference between now and when winter quarter starts for us is the same as the time difference between now and the end of March. And if you think about how much the world has changed since then, you'll know why we're just not quite sure what's going to be happening in winter quarter yet. So with those quick introductions, I'm going to start calling on folks in my beautiful Brady Bunch window of videos here to give you some quick background on what's going on campus and what we can expect. And so I'd like to start with Alberto Sandoval, who handles all of our government relations and also can tell you a bit about what we're doing to work with our local authorities as we counter this health crisis.
Thank you, Dr. Hayes. Appreciate the opportunity to join you all today. Just a quick overview of community and government relations. We are on a team that is the face of UCI, all our students to all our elected officials at the federal, state, county, and local levels. During this time, we have been working very closely with all of them regarding the challenges surrounding COVID. We've been not only a resource in terms of providing our expertise, our experts, our research, UCI Health, all that's entailed there, but also working with them on some controversial, but other policy issues, the CARES Act and what was passed in the House, the HEROES Act, and whatever is going to be coming out of the Senate. We're the voice of the students, the faculty, staff, and overall campus to all those elected officials. So glad to be here. Thank you for the opportunity. Look forward to hearing from my colleagues.
Thank you so much. And I will pass it over to the other Al, Dr. Albert Chang, who heads up student health.
Yeah, thanks so much, Jillian, and thanks for inviting me to this. For those of you who don't know that I'm Dr. Albert Chang. I'm the medical director at the Student Health Center. This building is seen behind me. And I've been supporting not only our facility to support the care of our students, but most recently with COVID needs as well. Just a quick summary, we provide services to those students that have our UCI SHIP insurance. We are basically your primary care providers. And so I may have seen some of you, you may have seen some of me, I see patients still, and we are a full service provider. We have some specialty care on site, we have psychiatry on site, we have laboratory, radiology, pharmacy, all these things. And so our primary goal and our primary mission is to serve the needs of our students so that they can excel and succeed in all of their endeavors. So that involves not only personal health, but also mental health and kind of population health. And that's where maybe I'll speak to a bit about what we're doing and our plans moving forward with COVID. So from the very start, and some of you may have received emails from me back in like February, March, when this was all starting up, we made big changes to ensure that the service that we were delivering was not putting any of our students in jeopardy and our staff in jeopardy. You may have heard that some of these really kind of difficult situations when one nurse or one provider or one clinic member is infected, all of a sudden from the inside, you're losing staff. And even having like 1 or 2 or 3 nurses out can be difficult. There are places that have lost like 10 or 12 people. And so we're making sure that things are safe. And what does that involve? So it involves screening for symptoms appropriately. We've moved to about 75% telehealth visits now. And there's nothing that replaces a face-to-face hands-on visit, but there is actually a lot that we can do through technology and through Zoom. And it seems like our students have really embraced that. Well, for one reason, it's accessible. So you can be really anywhere that you have your computer access, we can have an encounter, we can have a visit. But more importantly, it prevents potential infection from coming on site for movement of bodies or movement around the student health center. Now, if there is a need for a face-to-face visit, because I can't listen to your lungs over the phone, I can't do some certain things, there's a screening process. Our building has about 5 points of entry total and 2 points of entry typically for students and patients. We've reduced everything down to 1. So single point of entry. And if you come, don't be frightened. We'll have a nurse that's in PPE and they're trained to ask questions, screen, and do a bit of a temperature check, making sure that when you come in for your service, that you're not putting anyone at risk and that when you come in, you're not being exposed inappropriately either. But we are still doing all of our services and we're still taking care of the COVID situation. I think one of the big opportunities for me is to work in partnership with a lot of the departments on campus. A lot of the people you'll hear from today, we work all in unison. Our position as the clinical kind of support on site is a bit challenging sometimes because we are put to interpret CDC and California Department of Public Health and what the medical center is doing, what the county is doing. But it's through partnership that we're doing this all together. And maybe just one final point, as Jillian kind of mentioned, we don't really know what's going to happen in that future. If I was to look back in February, I would never have imagined, right, we're at where we are right now. And that was only, like 6 months away, right, 6 months ago. And even now, a few things are coming into place that is changing the way we're looking at how things move forward. One thing that we don't necessarily have a good handle on is the behavior of the virus, right? So we'll have to wait and see how the virus behaves and how that affects our populations. But I hope one big message that I want you all to take home is what we can control is behavior of ourselves and the behaviors of our population. So my commitment is to give the best information to you, to provide the best service, right, appropriately. But ultimately, and we've seen this with our students, when we behave well, when we minimize ourselves for exposure, when we take care of our own health first, that's when we can kind of get through this as a team together. I'll end there.
Thank you so much, Dr. Chang. I do have one quick question for you while we've still got you, because one came in as to whether TB tests are covered by insurance.
Typically they are, and so this is a big thing. If you're a new entering student, TB testing and immunizations, we have 4 required immunizations. We're adding influenza to that. That is all covered through your plan. That will be covered through us here. If it's TB testing for a different reason, call us, we can discuss that. But almost always the insurance companies will cover the TB test because it's a preventive measure.
Great, thank you so much. So while we're on the topic of what UCI is doing to try to ensure as much good behavior as we can, let's switch over to Rick Coulon, who can tell us a little bit about some of our policies and procedures that we're implementing in the buildings as people return.
Great, well, thank you, Jillian. My name is Rick Coulon. I'm Associate Vice Chancellor for Finance and Administration. I oversee emergency management as well as risk services, along with other operations on campus. But one of my tasks right now is to run the logistical support team. And there we're trying to ensure that we have all of the right cleaning products, that we're using the custodial team to properly clean the buildings with the right products and the right timing, that we have put up signage in various buildings, directing people to wear face coverings, to remember to do symptom checking, to keep your physical distancing, wash your hands. A lot of these reminders are really important just to keep people thinking about this and keep it on the top of their head. We don't expect that everybody should run around worried about COVID, but we also don't want to forget that this is something that's real and it's here and we need to take care of it. So part of our goal is to work with other campus organizations, helping them with their plans as they come to return to campus. There's another group that I'm involved with. It's the Campus Recovery Implementation Team. We call it CRIT, as well as the Provost Strategic Advisory Group. And all of us collaborate together to work on plans to make UCI as safe and ready to return as possible. A lot of that involves looking at the state guidelines, working with local public health. We want to make sure that as things change, and they do constantly, that whatever processes we have in place are sort of meeting those requirements or in many times exceeding them. So thank you.
Thank you, Rick. And so speaking of those student organizations and the many other support services that we have here on campus, I'm going to pass you over to the Assistant Vice Chancellor for Student Affairs, Edgar Dormitorio.
Thank you, Vice Provost Hayes. Hi, everyone. My name is Edgar Dormitorio. I'm Assistant Vice Chancellor and Chief of Staff in the Division of Student Affairs, and I'm joined here by all my wonderful colleagues across the campus, and some of them are also within the Division of Student Affairs. I'm glad they're here because they can answer all those tough questions around housing and the Student Health Center. As Vice Provost Hayes said, our division has the units like the Wellness, Health, and Counseling Center, which Student Health is part of. It has our auxiliary services units, and then it also has our student life and leadership units. Now, I think a lot of folks look at student engagement as mostly an undergraduate kind of thing, but we really are here to help serve all students, including graduate students. I think the reality is that we're in a really tough position right now, and we're here to promote and serve students, including their out of the classroom experience. Our units have had to pivot pretty drastically to continue that support. You'll find that a lot of our units are going to be delivering a lot of those services online, and I would recommend to folks to check on their websites first before attempting to contact them to find out what their procedures are and how to get in contact with them. And those might be units such as our counseling center, our Center for Wellness and Health Promotion, our clubs and organizations. You can find all their information on their website, and that's the way that you would find out how to be in touch with them and how to access resources. I'll leave it there for now and take questions later on.
Thank you so much. We are also getting lots of anxious questions as we're returning to research on campus bit by bit, as well as the kinds of questions about how do we do research if we're abroad, or how do we handle all kinds of things. So I'm happy that we have Bruce Morgan here from the Office of Research to answer some of those.
Good afternoon, everyone. I'm Associate Vice Chancellor for Research Administration in the Office of Research. And I am happy to report that the campus continues to operate within its research framework, which is broken up into 4 different phases. We are currently in phase 2. We have been in that phase since June. Fortunately, even with the surge of the virus within Orange County, we've been able to maintain the research labs operating pretty much at 30% occupancy. Every principal investigator, faculty member who is running a research lab or a research group has the opportunity to put forward a health and safety plan that we call a research phase 2 plan. Those then get reviewed by and approved by the dean of the school or the director of the research unit. We have a high level of compliance across the campus. Staff from environmental health and safety actually go out and conduct spot checks. And our compliance rate is very high, which I'm very happy to report. I'm very glad to see that everyone is taking these precautions very seriously. The phase 2 focuses on early career researchers, and that does include graduate students. We want to make sure that graduate students are able to move forward with their studies and their research. You can find more about what's happening with regard to research continuity and research phase 2 at the Office of Research website, which is research.uci.edu. I just want to echo that the future is unknown. At the present time, we do not have any plans to increase to phase 3. We are constantly monitoring the situation within Orange County and statewide, working very closely with our colleagues at the other campuses as well as colleagues at the county. And once we see the numbers heading in the right direction and staying at a lower level, the viral load within the within the community and within the county, that's when we will begin to consider expanding research into phase 3. And just so you're aware, all of these phases are primarily driven by the activities, but most importantly, the population density within research labs and research rooms. And with that, I'll turn it back to Jillian.
Thank you so much. And last but not least, many of you are in the process of moving into grad and family housing. So we have double trouble today. We have both the director of housing, Tim Trevin, as well as Laura Dorfman, who's one of our wonderful grad and family housing staff members. So we'll let them say a bit.
Thanks, Dean Hayes. First of all, we're excited to have you with us on campus this year. This is going to be a different year, but it's going to be a good year. And we're looking forward to supporting you and helping you succeed by providing you housing during your stay here at UCI. We have about a little bit over 800 new grad guarantee residents who will be joining us over the summer. The move-in process trickles throughout June, July, August, and September. And we're about halfway, we're getting close to about halfway in terms of our residents moving in. I want to give a shout out, a thank you to Dr. Chang and Dr. Bernadette Baden-Albala, our Dean of the School of Public Health. They have given us a tremendous amount of support and guided us on designing move-in processes and residents guidelines and policies to promote COVID practices and to make sure that we're operating in the most healthy and safe way possible. I also want to give a shout out to AVC Rick Coulon, who, as he was mentioning earlier, he's been instrumental in helping us develop campus standards for cleaning and for maintaining standards, COVID standards in our facilities. So we feel like we are in a good position to start our school year. And again, just looking forward to having you.
Hello, my name is Laura Dorfman. I'm the acting director for Verano Place, which is one of the 3 graduate housing communities. And we are looking forward to having you. We know that there's been some challenges and we're here to support you in whatever that looks like. So please reach out to me or to the housing office or to your community if you're receiving an offer or you're a little nervous and you think it's a silly question. Please reach out anyway. We get these questions all day long and we want to do whatever we can do to try to allay your fears and concerns that you might have coming in.
Great, thank you so much. So we'll start diving into the questions now. Some of them have been simple enough that people have been answering already as we go through. We've got a couple questions in about sort of access to buildings. And so I'm hoping we can hear from both Bruce Morgan as well as Rick Coulon on these issues as far as how we're establishing these return to campus research plans and so on. So Bruce, we'll hand to you first.
Thanks, Jillian. So I'm also a member of a committee called CRIT, which is the Campus Recovery Implementation Team. And this is a committee that's made up of about 30 representatives from across the campus. And one of our charges is to review plans that are being submitted by academic as well as administrative units to return to campus. So these would be plans that are administrative or instructional in nature, and not the research plans that I was talking about earlier. So for example, if you have an office that's not contained in a research space that's covered by a research plan and you want to use that office, you'll need to get in touch with your department, and then your department will need to coordinate through your school's dean's office. Typically that's going to be the assistant dean, to make sure that they're aware that you would like to use that space, and then they will work with you to try and include that space in their plan so that you may have access to it.
Thank you. And Rick, if you could just add to that and also maybe comment on the classroom cleaning procedures.
Yeah, absolutely. So I think Bruce did a great job answering that. And just one of the reasons that we really need to know who's coming in and out of the buildings is to ensure that those areas have appropriate supplies and are being cleaned. You know, it is important to know that. As far as cleaning procedures for classes, the plan as it stands now is that the custodial team will clean classes twice per day. We do have an electrostatic sprayer that will be used in the evening that sort of blankets the area with disinfectant that will help prepare it for the following day. Then inside or just outside the classes, depending on how it's set up, there will be disinfectant spray, hand sanitizer, gloves and towels to be able to have folks wipe down any areas that might be getting used more often, or where somebody feels that personally they want a little more protection, that they can clean off that area for themselves. So in addition to that, I know that we're trying to spread some classes out so that you're not constantly running into and out of each other as you go to courses. So that will be the plan as we move forward.
Great, thank you so much for that. We also have a lot of folks interested in questions about timing for things like wait lists, and if they haven't gotten an offer yet from housing, as well as if you all wouldn't mind talking a bit about housing guarantees for those who are unable to make it to campus, what we're doing about that.
I can take this one. So first, if you have a guarantee and you are, for whatever the reason is, are going to defer coming to the university or defer moving into housing, we will hold your guarantee. So if you have you can rest easy knowing you have your guarantee when you return. We will work to make sure it's timed out to your normative time to degree -1. And so you will have a guarantee that this is just a different year. So you might have heard from friends or previous, other students who are like, no, you lose your guarantee, you decline the program. Right now, we just want to focus on letting you do what's best for you. And then when you come to campus, we'll work with you regarding your guarantee. For those of you that, if you are a guaranteed student, I know I saw a couple of questions around, I haven't gotten an offer. If you are a guaranteed student and you have not received an offer yet, please feel free to reach out to either you can reach out to me and I'll find that out for you. If you are a student who has applied to the wait list, we have not yet begun to place from the wait list just yet. Normally at this point, we would start looking at the wait list to see where our numbers are, but we are still working around students as your plans have changed and you've come to us and said, oh, I'm able to come now for X or Y reason. And so as soon as we feel we've gotten all of our guarantees placed, we've gotten and we feel we've gotten all our first offers out to folks and we think our guarantees are settled, then we'll start looking at the wait list. And if you're feeling a little anxiety around the wait list and you would like to talk to someone about that, we have an awesome analyst. And if you, I can be your point person, or I can also provide that information out, but it's our grad status email, and she can give you some information about the wait list. We will be updating the website in the next couple of weeks as well, with kind of here's how many applicants we have, but this year is a little bit different. So we want to make sure we have all our guarantees squared away first.
Thank you so much, Laura. A couple of questions came in about things like face masks. So I just want to draw people's attention. If you're on Zoom and you are able to see the chat, Bruce has kindly put the link into the executive directive on face coverings. If you are not able to see the chat, I'm pretty sure if you just type into a search bar UCI's executive directive on face coverings, you will get there. You can also go to the UCI COVID main portal, and that will provide you that additional information. So we're getting some questions about libraries and other study spaces. Unfortunately, our campus librarian is not on this town hall. She's been on others. They are working very hard to make as many library services available as possible. Those are obviously in-person facilities that are closed and so on. So they're not as easy to open as some other areas, but I'll turn it back over to Rick and Edgar if they've got anything to add about things like that, the creative solutions that we're looking into, including outdoor study spaces.
You could take a look at the library's website, and actually they have a very good site on the reopening plans. To answer that question, it really depends on where we're at by the time fall happens, but I'm going to post that in the Q&A.
Thank you, Edgar.
Rick could comment on the study space. I mean, we're following the state's guidance right now on study space, and so there will be changes made and different spaces will be configured to be in alignment with the state guidance.
Yeah, and with regard to outdoor study space, we are exploring options for that. We've looked at the potential of putting out some tent areas that might be usable. We're all trying to work within the state guidelines as they are developed. Also potentially putting out additional tables, chairs located in outdoor areas. So those are all things that are under review. As far as indoor study space, that has been fairly well restricted up to this time. So we're working to see what might be able to be opened as we move forward.
And Jillian, just to jump in here about the libraries, since I reviewed their initial plan for reopening, it did include study space in the Gateway Center. Unfortunately, Orange County Healthcare Agency decided that at that time it was too risky. And so we were able to approve the plan without that study center access. In the meantime, the state just recently released guidelines for institutions of higher education. And the good news there is it looks like we might be able to open up that Gateway Study Center. We're looking into that option right now. So I think this is just a great example of how fluid things are right now.
Yeah, thank you so much. That's very helpful. We've got a couple of questions regarding healthcare. So we'll bounce those back to Dr. Chang regarding when SHIP insurance takes effect, and also a question about the flu shot. So I've answered the procedural question in the chat, which is the president of the University of California deemed that all faculty, staff, and students should get flu shots. And so that's the procedural side. But Dr. Chang, if you could speak to the public health side, I think that would be helpful.
For sure. And SHIP insurance typically goes into effect a week prior to that department's kind of enrollment or first day of service. So you can always call our student health center to make sure, because we've got different programs. For example, sometimes, graduate programs will start earlier, but there's typically about a week ahead of time for service. Now, if you're on site, you can definitely call us for consultation. There are many services that we provide that aren't being billed. And if you do, for example, or if you're still on your partner's plan or a parent's plan or something, we can always do service and then help you to get your retroactive reimbursement there as well. So so that's when the insurance typically starts. The influenza vaccine is very interesting, guys. So this is coming from top leadership at UC Office of the President. Our vice president for UC Health is Dr. Carrie Byington, and she is a pediatric infectious disease specialist. And I thank her because she's been on top of this COVID thing from the start. She's ensured that we as the UCI campus are talking to our partners at the medical center, that all of the campuses, I meet on Thursdays with all of the directors at all of the campuses, and we're collaborating in a smart way. And what has happened is COVID has kind of opened our eyes to potential gaps that we have on campus with as far as infection prevention, these type of things. And as I think back, influenza is also a devastating disease and takes thousands and thousands of lives every year. And you layer COVID on top of it, we're not too sure what we might get. So we don't have a COVID vaccine yet. We may or may not have one soon, but we do have an influenza vaccine. And so just to be sure that we're maximizing the health of all of our partners on campus, students, faculty, and staff, there is a mandate that's gone out. Now we're trying to work out the dynamics. So we've got maybe around 10,000 students and then several thousand employees that are around. So we're gonna do the best that we can to provide flu vaccination to all students. The great thing though too is that most of the insurance plans will cover for influenza vaccines as well. So the pharmacies in the community, they were our partners last year when we were doing our immunization vaccine. So you can go to Walgreens, CVS, Rite Aid, whatever's convenient for you. Now this is important, just get the vaccination. If you go for like a minute clinic visit, or if you want to speak to a consultation, they might bill you for that, right? But if you're just going there and you say, I want my flu shot, and by the way, get me my meningitis and my Tdap because I need that for my requirements too, they can do it. The other important next step is that does not get automatically updated into our system. So what we're asking you to do is take your results, go to our portal and put that in place. So influenza vaccine is going to be a big thing. We're working on the dynamics on how to make sure that all of our teams are covered, and we'll keep giving you updates on that.
Thank you so much. And Alberto Sandoval was kind enough to put in the state guidance regarding these issues into the chat for those of you who can access it. But I'm hoping you might want to comment a bit on the statewide efforts to do a combined public health response to this crisis.
So the governor really struggled with issuing these guidelines that he put out last Friday. So we're only a week into having guidance for higher education for 1 week. This was after several weeks of us being told that it was going to come out. So literally we were told he went through these with a fine-tooth comb himself and spent a lot of time working with California Department of Public Health, his staff, and input from the three segments, UC, CSU, and the community colleges and the privates across the state for providing input and how this would impact all the campuses. That said, there are some things in there, and I won't go into them now, but we're working with the governor's office right now to bring some issues to his attention that might impact our operations. But overall, the planning that has gone on at UCI was pretty much in line, and correct me if I'm wrong, my colleagues here, but pretty much in line with what the governor had issued.
Thank you so much. We've got a few questions here regarding PhD student funding, so I'll give my panelists a break and go ahead and answer those for you. The short story is, if you are a PhD student with a funding guarantee, that stays no matter what. If you are unable to get here, we are still going to fund you as we expected. What might change is it might be the case that we were anticipating funding you, for example, as a TA or on a research grant. And depending on the particular agency that is funding that grant, or the particular course you were slotted to TA, or a million other things, we may switch around what underlies your funding, but the fundamental idea that PhD students are supported at this university is paramount. And so I want to make sure that you all know that just because you don't know what you're doing for fall yet doesn't mean that your funding is in any jeopardy. Now, let me tell you a little bit about why you don't know what you're doing for fall yet. So it turns out that having you scattered all over the nation and the globe in some cases is quite difficult for us to figure out. So if we are looking to employ you as a TA, for example, but you're in particular countries, we may or may not be able to do that. Or if you haven't been able to do your English language speaking test yet, we may or may not be able to do that. Similarly, if you're on particular kinds of grants that may be required field work, well, it turns out that that may or may not work, and we may need to be moving you to fellowships and things like that. In other cases, we may have been planning to have you on fellowship, but it turns out you're able to be supported by a grant. So it's all very much up in the air right now. And we've asked departments to provide the information on what they plan to do to support their students by the end of this month, to give us a few weeks to make sure you're in the employment systems or in the fellowship systems. And if there's any glitches, we can catch them. So I know that's not what you want to hear when you're nervous, but please bear with us and be patient as we sort of work this out. And fundamentally, what I want you to know is PhD students with funding guarantees retain those guarantees. Now, for our master's students who maybe don't have a funding guarantee, just know financial aid is working on stuff. They're redoing literally everyone's calculations on the entire campus right now because they need to deal with changes in housing at both the undergraduate and graduate level, people suddenly living off campus or at home who were planning to be on campus, additional budgets for things like laptops and technology and so on that weren't necessarily expected. So financially, it's a little bit further behind than they normally would be this time of year, but we do expect to have these things coming out in the next 4 to 6 weeks. So again, please bear with us. I'm sorry if you are panicked about your particular situation. If you're a PhD student, reach out to your graduate program chair. If you're a master's student, reach out to financial aid directly, and they can look into your specific situation. But most of the time, we're going to ask you to just please try to be a little bit patient as we sort this out. So now let me hand it over to Tim and Laura to talk a little bit more about MoveIn. We've gotten a lot of questions both before and during this about exactly how many people are allowed to help move in and what that process is and so on.
Sure. I'm glad you're reading the arrival letter that you received, and it talks about many of those things. So things you can expect, and just so you know, I pulled up our housing FAQs, and I would advise you as a first point of reference is to stop by I Google UCI student housing FAQ every day when I'm looking at it and talking to students. I did see the question about helpers. We've designated to maximize the number of helpers at 2 as a means to minimize the number of individuals entering the housing communities, entering the facilities, and everyone that comes, a dependent, mover, helper, contract holder, all will answer the student health center screening questions that you can find on the student health center website. And students will eventually be using the everyday symptom check. And so you will answer those questions, and assuming everyone is feeling well, be giving keys to move in. I don't anticipate us turning folks away. However, we are really looking to minimize the number of folks in the communities at any given time. So if you're able to keep your number to 1 helper, 2 helpers, that is the ideal. While we are trying to phase out and our move-in, so we don't have too many in one day, we want to make sure we aren't creating incidents where people are feeling like they can't remain physically distant or there's stress in the community. And so that's the rationale and the expectation. Other questions that we've been getting around move-in, we do ask right now that if you don't have a move-in appointment yet, that you contact your housing community and set that up. We are moving in Monday through Friday between 8 and 5, with the move-in being completed by 5. And we're keeping them during business hours in order to be able to work closely with the student health center should there be a need when you arrive to be referred over to there. Yeah, I'll leave it at that. I'm going to look through the chat, see if there's any other housing questions at the moment. Again, feel free to reach out to your community with your questions, big and small.
Thank you so much, Laura. And I just want to echo what she's just said here. You know, sometimes I think it can feel like we're sort of making arbitrary rules and what's the difference between 2 people and 3 people, or why do I have to get a flu shot, or why do I have to do this, or why do I have to do that? And just to remind you that we are dealing with somewhere on the order of 15,000 different people on this campus who we need to serve. And when any one thing becomes a big thing when it's multiplied out by those several thousand people. So I know it's frustrating and I know it's really hard right now. And we just ask you to bear with us as we try to do a lot of things at scale in a way that really prioritizes the health and well-being of obviously all of you as our students, but also our staff, our faculty, your families, your friends, the many other folks that we're encountering in the community, and so on.
Can I add one more thing too?
Absolutely.
We may have residents who will be joining us who need an accommodation due to disability. And we do want to refer anyone who needs some kind of accommodation to talk with the Department for the Disability Services Center to get that accommodation. So if what you see in the FAQs, if that's difficult, then due to a disability, please do get a hold of them.
Thank you so much, Tim. That's a great addition there for sure. We've got some other questions that are specific about funding, so I just want to kind of address that more. I know that was a big thing for me when I was in grad school, was always worrying about where my paycheck was coming from and what was going to happen. So with specific different programs, there are different types of funding. I've got a question here about DNP students in particular, but just for all of you to know, the first stop in asking about your funding is always to check with the graduate program chair who handles your program to see what options there might be, because we have all kinds of fellowships that exist maybe only for people in certain disciplines or certain schools. There are different employment regulations. As of this year, professional program graduate students can TA. That's a new regulation. In the past, professional students were not eligible to TA. So for example, the DMP student was asking, that's a new thing. So just check with your grad programs about what some funding options might be if you're uncertain. And then those of you that are TAing this fall, we're getting a lot of nerves, and I will tell you, faculty are very nervous too. We're having to teach in ways that we really haven't done before. And in the spring, everyone was sort of in the panic adrenaline mode of let's all just move to online and it's an emergency and we'll make it work. But what we've been doing here over the summer is really taking seriously that that's not acceptable past this emergency moment, that we need to make a very high quality experience no matter what is going on in the world. So we've actually deployed about 300 graduate students to get extra training in remote online instruction, so that we have people in all of the schools who now have done a bunch of extra work with our Division of Teaching Excellence and Innovation, so they can support you and help you and be your peer mentors and be there for you. They're also supporting and helping our faculty right now over the summer who are revamping some of their courses. Also, many faculty are getting additional training over the summer as well. So things are sort of rapidly changing, and what it might look like in any particular class is something to talk to the instructor you've been assigned to really see, you know, it may be that in some classes you're predominantly focused on sort of asynchronous checking in with chat boards and things like that. In others, you might host in-person Zoom discussion sections. It might be a wide variety of kind of experiences depending on the field and the course. So check in with the individuals you've been assigned to. I don't know of any departments that have done their TA assignments yet, though, so you probably don't know who you're working for yet if you're going to be TAing this fall. So hold tight a bit while we figure that out, and I am sure that they will be in touch. And then we've also got a few questions in here that we'll address in more detail next month at the town hall, September 11th. We will have an international focused town hall, but our international center is really working as fast as they can to get I-20s reissued. Edgar, I don't know if you want to speak to any of that. We don't have someone from the International Center here, but they are under Student Affairs, so he may be able to comment a little further.
Probably not a whole lot. The International Center is one of those areas, as you know, a lot of the details around requirements to come to the United States are, they're experts at it. And so the smart answer for me is let's defer to them to answer the question. So hopefully folks will be back next week, because I think you'll enjoy, and they're just full of knowledge. So it'll be great for them to be able to speak at this forum.
Yeah, and when in doubt, please do reach out to the International Center. They are quite backed up, but email is the best. They've got a big monitored email inbox, and they do process through things. For those of you who are needing your visas, your I-20s canceled and reissued, they are getting to them. They're doing them in priority order. So if you have an appointment already at a consulate and need a fresh I-20 for that reason, please mention that in your email to them, because they are prioritizing those folks who have appointments. If you don't have an appointment yet, please sit tight and just know that those who do have appointments for obvious reasons, or for hopefully obvious reasons anyway, we do need to prioritize those and making sure that everyone is able to come into the country as soon as we can. We obviously want you all here, healthy, and being successful as soon as we can. It looks like our questions are starting to stabilize, which is perfect timing, because we've only got a few minutes left in the town hall. This is recorded, and UCI Media Services posts it, and we post it on the Grad Division website as well. We heard there were some challenges with getting things posted through Facebook only, so I believe UCI Media is working on posting this to YouTube as well. So you've got a couple of different options depending on platform preference and abilities, but that will get posted. And I just want to again thank all the panelists and take a moment to, I'm going to call on each of you. If you don't have anything to say, that's okay. But if there's any sort of final closing thoughts, you want to make sure that the students are able to hear from you, this would be your time. So we'll start with Dr. Chang.
Yeah, thank you, Jillian. So I wanted to touch base on one very important point, especially for the graduate division, is that's a resource with when things get a little bit out of control. So at Student Health, one of the things I know for sure is that all of our students are stressed out. And graduate students, it's another level. It's hard to get into UCI, it's hard to stay into UCI. Now you add a global pandemic on top of it, and we're all like nerves. And so the Counseling Center is a fantastic resource. I know that the graduate division has counseling as well. And it's nothing to be ashamed of. It's something that I think we should all embrace and utilize as a strong support. Technology is allowing different types of access. So there are apps, there's telehealth, there's these things. We have to take care of ourselves first and foremost. And so I think that's a very important factor that's there. I wanted to share for those of you that are existing students, I'm incredibly proud of the work that you've done. And this past year, this past few months, you know, I have an eye on our student level, our positive numbers, and we hit a little bit of a surge right here and there, but we're seeing that we're really stabilizing. And it shows me that you are all doing those right best things to make sure you're taking care of yourselves. And especially when on campus, you're taking care of our community as a whole. So for those of you that are coming on, I look forward to having you as members of our Anteater family here. I know that you will do a great job to keep yourself safe. And the key for me is transparency. The key for me is engagement. So you let us know what we can do to do best for you. Thanks.
Thank you. And over to Rick for any closing thoughts.
Yeah, Jillian, well, I just want to say thanks to you and thanks to everyone for listening out there. You know, one of the things that this is going to take is everybody's participation and cooperation as we try to work through this. So we need people to be serious about face coverings, about social distancing. It won't take a lot to have the state government, the local county, or even the campus decide that we need to maybe turn back or do something different. We don't want that to happen. We want to keep moving forward. And so with everybody's help, the people here on the team that have been working to try to put things together in a positive way, and then all of the students' help and cooperation, I think that we can continue to move forward. So thank you.
Thank you. And over to you, Edgar.
sort of ditto to everything that both Dr. Chang and Rick mentioned here. We look forward to the students who will be coming here on campus. Yesterday, you may have received, especially for folks who are in our graduate family housing areas, email regarding the daily symptom check. And so we're going to begin rolling that out, and we really need folks to participate in that. So I encourage you to do so. Then other than that, look forward to seeing folks who are coming in the fall.
Thank you so much. Tim? Tim is muted. Oh, there he is.
Yeah, I think I agree with everything that my esteemed colleagues have said. Again, we're looking forward to having you. This is an odd year in housing. There are many different nuances to how to apply, how to get in, how to move in. And so we really just want to put out there that we're here either through email or phone to answer any questions that you have, and make that transition as simple as possible.
Thank you. And Laura, our second on the housing side.
I would just echo that we are excited to have you, and please ask questions. We don't want anyone to feel like they're suffering in silence. If you have something going on and you feel like, I'm sure everyone asks that question, just ask it anyway. You can ask it and MoveIn. And just know there's a lot of really great resources that are here to help you have a great term, to get what you need to get done, and we'll do our best to help you along the way. So please reach out with your questions and be well, and we look forward to moving you in soon.
Thank you, Laura. Alberto?
Thanks again for the opportunity. We've got a small team of 3 who do advocacy and government relations and community relations work, but we're always looking for advocates. I'm going to stick in the chat box the UC Advocacy Network. I hope all our students and those listening in would sign up, because we've got a lot of messages that go out, and sometimes we can use your phone call to the governor, to Congress, or to the Senate. We could use your help. So thank you.
Thank you. That's such a great point. I hear from so many students that they feel frustrated and helpless right now. This is a way that you really can help and get your voice heard. So thank you. That's a great suggestion. And of course, last but not least, over to Bruce.
Thanks, Jillian, and thank you for having me on the town hall this afternoon. I think my wonderful colleagues have really summed everything up really well, and I don't have anything to add, except welcome to UCI, everyone.
All right, thank you all so much. So again, I just want to remind you all, we are so glad to have you as part of the Anteater family, and we are sad that we don't get to see you in person, but hopefully soon. And you'll have great stories for your grandchildren one day. So thank you for your attention. We look forward to seeing you when we can. And Rick's given us a little zot. I never do mine right, so I'll try. There, that many better examples than mine. Thank you all. Take care. Have a wonderful weekend.
Thank you, Jillian.